focused in front of you is the right hemiscrotum, that of 37 years old male. He has presented with 3 days, he noted a swelling 3 days back in the right, on the right side of the testis of the scrotum, and this is what we are seeing. If you see, all of the testicular parenchyma is occupied by multiple cystic areas with internal. Now this is a cystic area, the largest one that is seen on this image, measuring 12.2 into 13 millimeters. With now you see there are septas within it, and there is a tiny calcification. These are small ones. This is the another one. Now this is the another one. This cystic pocket measures approximately 10.8 into 8.4 millimeter, and you can see multiple tiny echogenic areas within it. This is the testicular tissue otherwise seen. Now the intervening testicular parenchyma, that of the right testis, shows normalcy in echogenicity and blood flow as well. We will study later on. So this is and the testis is enlarged. See the size of the testis, as for example, if I try to get the size of the testis in anterior posterior diameter, okay, let's see. Now you see, this is the maximum that I can get in this view, and the size of the testis is 3.2 centimeters, and this is a significant PLI size. Whereas though it's not possible to get the total of this testis in longitudinal section because of it's being enlarged, however, if I try my best, I can get you this one. So in length, approximately it measures, this is just an approximation, 5 centimeter approximately, or say 4.8 centimeter to be on the relatively safe side. And this is the, again, 4.8 into 3.4 centimeter. And note these irregularly outlined cyst. This is a regularly outlined cyst. This is a cyst with echoes, and that we will study in a few minutes. Now I'd like to focus one such cystic area. And you see here, this is the largest one seen by a grain, approximately thin walled it is, measures 11 into 8.2 in this view. Now this cystic area has thick wall, and then this is a tiny this is a calcified area. This is the tiny calcification giving you posterior shadow as well. This is the layered posterior wall, layered out tabulate, and these are small incomplete septas within this cystic area. And this is the another one. This is the second one, in which again you can see all the features. That this is the third one in this enlarged view, which is clear in. Now I'll apply to see if there is any blood flow in this region. And these cysts are communicating with each other. If you note, the cysts are communicating, and interesting thing, another important rather to see is that the venous supply This is the vein. In Torian, the venous supply is really absent. I don't see that. Venous supply is compromising the Torian of the testis, whereas here you can see this blue structure, which is the vein, this one, this area. Okay. Now these cysts are, if you note, communicating with each other. I am going to give a very slow speed. So arteria, this is the vein. Now here comes the artery, red. So communicating cysts with multiple tiny internal calcifications within. So this is so far the study of the cystic areas is concerned, relating to the right testes of this gentleman, age 37 years, and they are seen, and the cysts are seen everywhere, almost everywhere, from tiny, very small, maybe there are pinhead size also. This is the tiniest one I can see, and this is all by variable sized communicating cysts with internal septa and numerous calcifications, tiny calcifications, and you can see these bright structures are all tiny calcifications. There is no history of trauma. Patient is not tender to the probe. There is patient is not toxic, no fever, no lab profile available. Now, see the blood flow. All of it is showing you all of it. Okay. The equipment that I have is not that powerful, but anyways, this is the venous supply, and minus 3.2 centimeters, and then I try to get some arterial vessel as well. Let us try. Say never give up. Carry on and you will be rewarded. Be patient. Patience is required in ultrasound. You can't hurry up with everything. Let's see if we can get some arterial supply. Now these see the velocity of blood flow in this vessel. Approximately 5.9 centimeters per second. Okay, let's try to trap some other vessel as well. That can give us a little better information. Now, if you note that the vessels do not cross the cystic areas. They are at the border, and they just you can see around the border, course the border of the cystic areas, and transfer section. Let me try to focus it better. What I'm trying to do is trying to grab some artery somewhere. So far, not possible to grab any artery. Veins are in abundance. And one thing that I want to show you is that this is a cyst, and you see the debris within it. This is human. Why not? Okay. Go through all. Let's see. Yeah, this is the one which is more beneficial. Now the velocity of blood flow in this is approximately 5.7 centimeter per second, whereas the resistive index is 0.64 with pulsatile index of 1.00. So this is the case of multicystic kidney, multicystic testes, possibly as the patient is not tender, no hydroceles, no fluid seen in the hemiscrota, right hemiscrota, and the patient is not tender to probe. This is the epididymis. We missed that. I didn't show you initial part. Here it is. This is the epididymis. Sorry. This is the epididymis on the right side. This one. This structure is the epididymis. And it measures 2.1 into 7.7 millimeter is normal. Don't see any edema. You don't see any significant anomaly in this region. So this is the right epididymis that I have shown you. And on power Doppler, it is being well profused. Now this is our study of the day. Either abscesses or Taurian. No, I will rule out Taurian. This is some granulomatous disorder affecting the right testes, and these are suggestive of abscesses. The cystic areas are suggestive of abscesses right side, right testis. The wall of the testis is not that thick. Communicating cysts. Left is normal. This is the left testis. This is the left testis that I am showing you, and it is normal. It's an enlarged testis, and you can yourself count the number of variable sized cysts within this testis. Thank you very much.